So Neeraj, you were telling me a little bit about the power of kind of this laser guided surgery implants. Talk me through the process. What is this? Where does it all start?
So Alex, after doing the initial consultation with our client, then the next step is to take a 3D bone scan, and this is where the journey starts. So we take a full jaw scan, and then you can see this outside.
You were just saying about it being like a CT scanner. So it's just like this is just like a CT scanner for your head.
This is for just for the head, but we're really interested in the jaws. So we can see other things, but primarily we're focused on what's going on in the jaws. So we can see hard tissues such as teeth. We can see bone. We can see defects in bone. So sometimes people will come in and they might have issues going on that haven't been detected, and we can actually see that. And all the scans that we take, we send them to a medical radiologist as well, just to make sure that nothing has been missed. So it's a great thing. I wouldn't do it as a proactive measure because I feel that there has to be a justification why we're taking these.
So, because there's, I guess, when with CT scans, there's that element of like a radiation element to it. So is that why you wouldn't actively encourage people to get it done? You only do it if you have to?
Yeah, I mean, interestingly, the radiation element for this is minuscule. This is probably, having a scan like this is like a flight to London, so it's really nothing. But everything is cumulative, so we have to think that whatever we're doing, it's like a dose that we're giving you, and what's the reason why we're giving you. So if we want to be good clinicians, we need to be thinking about, what we're doing to our clients, and what's the benefit that they're actually going to get.
It would be good to understand a little bit more about when this would be called into action. So if I came to you and I had a sore tooth, you wouldn't just be like, get you on the bone, the CT scan.
No, that's a really good question. So if somebody came with a sore tooth, we would maybe take a small x-ray. That's like a telephoto shot, and we can really hone into that area, see all the problems. But say we weren't sure, say that person needed a root canal, but we can't see why they need a root canal on that x-ray, this is amazing. Because then this can see that in 3 dimensions, things that are hidden behind the tooth. Remember, it might not just be a tooth issue. It might manifest as a tooth pain, but it could be something else. It could be a sinus issue. It could be some cystic lesion that's growing there. It could be other things that are growing there, and this will help us to identify that.
So it's like so you've got your basic is your X-ray, and that's just a flat image.
Yeah,
really.
Because it's easy to do and it's quick. Whilst with this, we need to set it up. Then remember, every scan that we're taking, every x-ray we're taking, we're reporting on that. There's a lot of data on this, so it takes a long time to report. So you really want to be sure that you really need to do that. So this is more for 3D planning for implants, because implants were done freehand before, and in fact most clinics still do it in that way, but the best is when we do it guided, because we're thinking about the end in mind. It's no different than an architect. An architect looks at the house, designs what it's going to look like, what the field's going to be like, and then they go and get the builder to do what needs to be done. You wouldn't just go and say, let's go and build a house. And that's exactly what we do now with the implants. And the reason why we're doing this is because people are living for much longer now. When implants started, it was much more for elderly patients, but now, you'll see people in their 30s plus having it done. These people are going to live a long time, and we really want this to work for a long time. This is not for 2 years. And if we do our job really well, if we've planned it really well, if we've looked at everything really well, then we're going to get much more longevity, and the clients are going to be much happier with that.
So for an implant, what's normally the reason somebody would have an implant?
Okay, so an implant would be because you've got a missing tooth. You might have had gum disease and you lost those teeth, and so you're looking at now solutions. It's a bit like a prosthetic limb. You lost the limb, what are you going to do? How are you going to get that function back? So an implant now is the gold standard, because it's almost like giving you your teeth back. It's also something that's easier to maintain. It's something that will hold the bone much better. The other options are obviously looking at things like dentures, but it's a more kind of old style of dentistry. You're never really going to get that function back. Aesthetically, it might look good, but then people are self-conscious. The fact that you have to take it out, with an implant, it's there, you can forget about it, you clean it like your natural teeth, and that's all you need to do. So if you sit down on that, it's going to slump very quickly when you're very light. Okay. Okay. It's really annoying how slow these things are. I don't know.
I don't know. I think if it was too fast, it would freak me out.
Yeah, I think maybe that's why they do it.
Yeah.
So you put your chin down here and you hold these handles here, Alex. You'll see that there's handles here. Okay. So now you can see, I'm just going to bring this down, Alex. So sit nice and tall, and you're looking up, so rotate your chin. So sit nice and tall. Right, so, okay, I'm going to bring this down. Okay, don't put your chin on that. Just that. Right, and just bring your head forwards like this. Okay, so I'm going to bring it down until you can fit your chin in. There you go. That's more comfortable, isn't it?
Oh, yeah. Oh.
Okay, so the other benefit of this is that we can really hone into the area that we're interested in, because we have these laser guides, and so we can go into just even one or two teeth. We don't need to take a whole jaw scan. And again, that cuts down the amount of radiation. In the end, obviously we want to do the best benefit for the client with the least amount of intervention.
So is there lasers on my face right now? Oh, can't see them.